Hi, everyone. My name is Maria Graham. I want to say firstly, thank you for inviting me today and allowing me to speak. It's a big privilege. So today I will be sharing some preliminary insights for an analysis that I've been conducting to assess and compare the priorities, action lines, governance, and implementation um, as well as the monitoring and evaluation approaches of different global health strategies. I've been carrying out this work as part of my internship that I started in mid-March of this year at the French Ministry of Health. And since then, I've been working closely under the direction and guidance of Jérôme Weinbach and Anne-Marie Tremblay. But before I begin with the analysis, I thought it could be interesting to share some information about me. So I'm from London. I was born and raised there, and at 18, I moved to Montreal, Quebec to pursue a Bachelor of Science in Anatomy and Cell Biology. And after graduating, I had the opportunity to work as a clinical research coordinator for a pediatric clinical trial, as well as a physician assistant for a pediatric family medicine clinic. And I would say it was really during my time in these two places that I first saw how access to care goes beyond just having the right medicines. And there were numerous factors such as a patient's geographical location, their household income level, their education level, religion, gender, and so forth that got in the way and often prevented those patients from being able to access or benefit the care that they were both legally and morally entitled to. And coming from a science and technical background, this was completely new to me. It was something I'd never studied or learned before. And I was intrigued and I wanted to know more. So with that, I decided to pursue a Master of Public Policy at Sciences Po, an LSC, a dual degree, and that's why I'm here today. So as you can see, here is a list of all the different institutions and countries with their own global health strategy. The goal of the joint action here is to maximize the impact of the EU global health strategy, but as you can see, there are many countries and institutions beyond the EU that have their own strategy, and a big question that we have is how do they interconnect, how do they work together, how do they complement each other, and that is the focus of my research today. I'm only about halfway through, and of course have not had a chance to review all the global health strategies that you see here. So today I'm going to focus on what I have found and learned so far comparing the European, the EU, the French, and the Dutch global health strategy. So this pathway kind of is a visual depiction of my methodology so far. So the first approach that I took was relative word frequency text analysis. I was actually inspired by the German Institute for International and Security Affairs, who use the same technique to measure essentially on a linear scale how closely related national global health strategies of EU member states were to each other. And this was the first paper I read at the beginning of my internship. So I wanted to see if I could replicate their results. Following this was a directed content analysis approach. Within this, I developed essentially my own coding framework built from the priorities and guiding principles of the EU Global Health Strategy to enable me to now more systematically map and compare the content of the different global health strategies. And then after that, SWOT analyses, as well as interviews. For some reason, the image is a bit, sorry. So for these, I thoroughly read through each of the strategies and made notes as well as annotations. I actually used World Package 5 did a SWOT analysis of the EU Global Health Strategy, and I used the guiding questions that they included in their framework to focus my way of thinking and also guide me through my analytic approach to make sure that I was seeking out the right information when I was trying to find the respective strengths, weaknesses, opportunities, and threats for each strategy. And additionally, as I was conducting these, I made sure to make note of any questions that arose. I had the opportunity to speak with representatives from the ministries involved in the coordination of both the French and the Dutch Global Health Strategy, who are also partners of this joint action here. And I used these interviews to find out as much information as possible about the strategies that weren't explicitly written in the text to help supplement my SWOT and the quality of my findings. So here is just a visual depiction of the word frequency cloud technique that I was talking about. I actually took a Python class this year, and they taught us different ways to visually visually describe data that we've been given. And one of the techniques they taught us was how to code a word cloud. So as you can see, the bigger words represent the words that are most frequent in the EU Global Health Strategy. So for the EU, the most frequent words were WHO, One Health, and partnerships. Of course, this is not a perfect measure of the priorities of the EU because there's no context or meaning given to these words, but I think it does offer a quick snapshot of the dominant themes within the EU Global Health Strategy, as well as the sort of guiding umbrella framework that the strategy gives to member states who are either thinking of updating their current national global health strategy or even creating one. And here I have a visual depiction to show to what extent certain priorities or principles are emphasized. In other words, how much weight or focus they are given in each of the 3 global health strategies. So we have the EU, which is in green, the France, which is in blue, and the Netherlands, which is in red. And so for this radar chart, I included 8 of the most consistently recurring themes between the 3 strategies. These include health system strengthening. Oh, I'm so sorry about the quality of you can't read it, but that's meant to say number 2 is pandemic preparedness and response. SRHR and gender equality, climate change and health, universal health coverage, digital health, strengthening multilateralism, and human resources for health. And I rated each of them on a scale of 1 to 5. So 1 being more minimal focus, it's mentioned in the strategy, but not very consistently. And 5 being that it's core to the strategy's identity and a flagship area of the strategy. And as you can see on the graph, the areas of strongest convergence between the 3 strategies were health system strengthening, pandemic preparedness response, and universal health coverage. For health system strengthening and pandemic preparedness and response, these were core priorities for all 3 strategies. And for universal health coverage and also multilateralism, sorry, I forgot to mention that one, which is a strong point of convergence, they were core priorities for 2 of the strategy and more of a guiding principle for the remaining one. And then in terms, on the flip side, areas of the strongest divergence between the 3 were the digitalization of health and human resources for health. Both of these themes were mentioned by France and the Netherlands in their global health strategy, but in my interpretation of the strategies with digital health in particular, they were not necessarily something that the strategies were taking strong directed action towards. And I do want to make this point to reiterate this idea that in reality, every major theme is shared across the 3 strategies. They all agree on what matters, but as you can see, where they differ is the relative weight or emphasis that they give to each priority, which of course is normal because it is impossible to focus on everything. Then for the SWOT analyses, I had actually created individual SWOT analyses for all 3 global health strategies. And I also did cross-comparison SWOTs for the 3, but I felt that was not enough information to share. So I decided to produce a blended SWOT for this presentation because a lot of the points overlapped a lot anyway. and I do plan to put all the fine details in the final report that I will write at the end of my internship. So for the strengths, all three strategies demonstrate, all three countries, including the EU, demonstrate very substantial financial commitment to global health. Each institution positioned itself as a key player in global health diplomacy and multilateralism, and all three recognize their role as leaders in scientific and technical expertise, which they're able to leverage and share globally. For the weaknesses, one common weakness between the three was their difficulty in achieving seamless coordination. Having coherence among their diverse stakeholders is an ongoing challenge for them. As well as this, enhancing external communication and clarity of messaging is a key area of improvement for all three strategies. One strategy even admitted that previous communication regarding its global health actions during COVID was not good and actually led to reduced perceived impact and mistrust from partner countries. Finally, all three global health strategies acknowledge that their current global health policy does not suffice to meet and achieve their ambitions. Okay, yeah, thank you so much. And therefore, necessitating a new structure for innovation and collaboration is key. For their opportunities, do I click it? Yeah. Okay. For their opportunities, all three strategies highlight the post-COVID environment as a critical juncture, recognizing the political momentum generated by the pandemic as an unprecedented opportunity to actively shape the future of global health. Additionally, the increasing global recognition that human, animal, and environmental health are intrinsically linked is presented as an opportunity by all three strategies, as this directly supports their shared foundational principles of One Health and health in all policies. Also, the ongoing international emphasis on ensuring fair access to essential health products is seen as a major opportunity by all three strategies, as it aligns not only with their individual expertise in research and development and capacity building, but also in their shared goal of increasing local production infrastructures in low and middle income countries. Finally, for the threats, all three global health strategies identify the current unstable geopolitical landscape as a significant threat, as rising geopolitical instability as well as global crises strain health systems and exacerbate inequalities. Also, the current economic context is a shared threat for all the three strategies, as it limits the fiscal capacity of governments to invest in health, thus challenging sustainable financing. As well as this, current growing social political resistance to development cooperation due to mistrust and misinformation, exacerbated by COVID-19, also undermines the efforts made by the EU, the Netherlands, and France to achieve their global health action objectives. Climate change and the environmental degradation, as mentioned previously, human health, animal health, environmental health are all very connected, and the three planetary crises contributes to the complexity of global health challenges. And finally, characterized by a lack of coordination and financing gaps, the current fragmented global health architecture challenges the EU, the Netherlands, and France in delivering collective global health actions and responses. So this opportunity is one that I want to highlight because it is the theme of the conference today, adapting to a changing world. And in a world that is rapidly evolving like it is today, I believe that having a coherent and responsive monitoring and an evaluation mechanism is more important than ever to ensure long-term impact as well as accountability and agility of global health actions. Sorry. So here I have a visual depiction that is a bit dense, but it is to just show the current governance, monitoring, implementation, monitoring, and evaluation frameworks for France and the Netherlands. And here I will speak on some of the similarities that they have as well as their specificities. One big similarity is the fact that the key coordinating ministers for both global health strategies are the Ministry of Health and the Ministry of Foreign Affairs, with one specificity being that France also included their Ministry of Education in their coordination. In terms of the governance teams created for the coordination of the global health strategy, for both countries, the governance is largely multi-sectoral, including other relevant ministries, the private sector, knowledge institutions, scientific experts, and civil society. One specificity being, though, that Team France, the governance system for the French global health strategy, was created at the beginning in order to set in place and help with the development of the global health strategy from the start. Whereas with the Dutch, their global health strategy was, their Dutch global health hub was implemented post implementation of the global health strategy to help with the smooth operationalization of the strategy itself. In terms of implementation, a key commonality between the two is given their long-standing history and expertise in development aid and global health action, they both choose to continue in investing in their own well-established initiatives and leveraging those, as they are both not starting from scratch, so they have their own resources that they know work. One specificity, though, is that with Team France, implementation is more collective and they are all working at the same goal together. Whereas with the Dutch Global Health Hub, the hub is actually subdivided into 3 separate COPs, each with COPs being communities of practice, each aligned with a specific focus area. And then depending on that, that's how they structure their action. And then regarding the monitoring and evaluation, a key specificity for the French Global Health Strategy is the fact that they are one of the only member states to have a set of quantitative indicators used for their evaluation framework. But a commonality between the two is that it is the Ministry of Health for both countries that is involved in tracking and communicating the progress of the strategy. So with all that in mind, I wanted to share some final thoughts. The public evaluation of reports that I have been able to read, from what I've seen, all tend to speak, as they should, largely about what has been achieved, what went well, investments that they made, resolutions that they supported, and so on. But one key piece of information that I see doesn't really get included is actually what didn't go as planned, what obstacles came up, what proved more difficult than expected. And this is information that can only be known once the implementation of the strategy has actually taken off, because no matter how many years of expertise or research, stakeholder input that goes into a strategy, it is still largely very theoretical until it is actually faced with the complexity of the real world. And that was one really positive aspect of the Dutch Global Health Strategy, because they explicitly left their strategy flexible enough such that when it comes time to do their midterm review in late 2025, they will be able to make adjustments to their priorities and so forth, depending on new insights that they find, global developments and such, and new experiences that they have. But in order to know what to adjust, I believe that one also needs to know exactly what they are measuring. And that is a key aspect of the French global health strategy. As I mentioned, the only member state that we know of that actually uses a set of quantitative indicators to perform its evaluation. And although the goal of this joint action here is to maximize the impact of the European global health strategy, I believe that the real impact actually does come from that of its member states and the work that they do. So that is why I ask, why not use this moment here in a space that is safe and confidential and we're all working towards the same goal, multiple countries within this room years into the implementation of their global health strategy. And now with the new knowledge and insights on challenges that emerged, what surprised them and what they would have done differently in hindsight, that is, I believe, very crucial information to share. And the shared goal in this joint action is meaningful impact, not just the process. Therefore, creating a culture of learning is very key. And I believe that it would be a shame for a country such as Spain, who is now working towards the same goals as its partners, who has also just established their global health strategy, to only end up making the same mistakes and errors as their partners potentially did because this information was not shared. And for that reason, having a part 2 of the joint action could be really impactful if we do actually move away from talking about what wants to be done and what should be done, and now to how we are actually going to do it. The point of the joint action was to build tools to improve coordination. So now that we have those, what can we do about it? Thank you.